Folks, thanks for joining us today. My name is John Dubas with Premier Marketing, and we'll be spending the next 55, 60 minutes or so discussing a planning process for the upcoming annual election period. We're looking at this from a little bit of a different angle as well, because we want to make certain that the things that we do to prepare for the open enrollment of sorts also affects our business positively now and moving forward. We're going to inject a little bit of humor into the conversation as well. The world is a little bit of a cloudy space right about now, and we want to make certain that we're able to incorporate in a feeling of moving forward positively, and we're about to do that. You'll notice that in the software package, there is a section for questions. Please put your questions in there. We find that we do answer most of them through the course of the presentation, but we'll make certain that we address any inquiries that you have for us, either with a direct answer right away or through follow-up correspondence through either myself or the marketer that you work with. We'll also be recording today's presentation. It is being recorded, and once it uploads, it will be made available on our website at premiersmi.com and also on our YouTube channel. It will be made available through the marketers within our organization as well, so you'll have this detail. Any questions that you might have or specific requests, we'll look to honor and make certain that we can support not only the theory we're putting out here, glorified or not, but also to make certain that the substance follows through with it as well. For those of you that are on the call with us today, many of you know who Premier Marketing is, some not so well, so a bit of a level set. We're a national marketing organization founded in 1968 that's part of the Integrity Marketing Platform, with offices across the country, licensed in all 50 states. We act as an insurance wholesaler, working with independent insurance agents such as you through contracts that are at the highest possible commission levels, with recruiting contracts available to those who qualify. We do so through a portfolio of programs that can positively affect you across the board, particularly in a planning process. And it's a key component of having the programs that you need in play with you. And we do so through the Medicare programs, the Medicare Advantage, Medicare Supplement, and standalone Part D prescription drug plans, but also a full portfolio of life insurance and annuity products, including final expense life insurance and pre-need plans. We also offer long and short-term care programs, disability income plans, and those ancillary benefits that fill the specific needs of the folks that we address. Specifically, dental, vision, hearing programs, critical illness cancer plans, hospital indemnity programs, accident plans, and even a telehealth program. With the Medicare Advantage programs, as we plan for AEP, this is a key component within our structure moving forward. The national carriers are here, along with many of the strong regionals that can make a difference for you in your market. These are key partners, not only in the delivery of product, but also in our planning process and in marketing programs that are available through different organizations that we can tap into to make part of the plan more than just a plan, something to move forward. Same philosophy carries over into the standalone prescription drug plans. Those PDP programs in most cases come as part of your Medicare Advantage contract. A couple of notable exceptions. Mutual of Omaha's contract is separate from many of their other programs for their prescription drug plan. And the Clever RX program, well, that's a discount program and not a standalone prescription drug plan. When we look at Medicare supplements, this also is a key component in addressing the full gambit of Medicare beneficiaries and their needs. A robust portfolio with a lot of support programs in play, not only to find folks, but to enroll them. And we consider this a key component in our planning process as well. Look at ancillary products as a key portion of that as well, because you have in each of these categories demand products with the national leaders that give you an opportunity to market a bit differently, satisfy specific needs, obviously, which is a key aim as to what we look to do, but it also gives us another revenue flow to fund other activities, including the basics that we need as part of our day-to-day operations. When we look at the Medicare market overall, knowing where we stand and knowing some of the differences that come about with people within this demographic, we see obviously the burgeoning market, the aging of the baby boomers, the silver tsunami, one every 10 seconds, 10,000 plus a day based on age, on turning 65. We find, however, that there's an increasing number of individuals that turn 65 and aren't accessing their full benefits right away for one reason or another. Some of the tail end baby boomers may be working through age 67 so they can file for their full Social Security benefit and combine the two as a bit of a retirement strategy. Some may be working because, hey, that's what I like to do. I want to work. I like my job. This is what I'm going to continue to do. And then, of course, economic circumstances, perhaps personal or fostered by the pandemic, well, some people need to work a little bit longer as well. But whatever number is taken out here, we more than make up with for the fact that there are a good portion of people on Medicare under the age of 65 because of medical disability. Looking at each of these key components gives us an opportunity to figure out where we point some of our marketing efforts and make certain that we are looking to accommodate the people that we meet, the people that we visit with a proper solution to their needs as well. Because they got choices. When someone gets on Medicare, they don't have to do anything. They can even decline Part B if they want to. Thankfully, most don't. Some will self-insure for the shortfall within the benefits of the basic traditional Medicare system. Some might pick up a Part D program to help with prescription drug costs. Others may enroll into a standardized, modernized Medicare supplement, which gives us a lot of opportunity for other programs, not only just that Med Sup, but other programs that are necessary for coverage, including picking up that Part D coverage because Med Sups don't have drug coverage or Part D drugs. I don't mean to say it doesn't cover the Part B stuff, but it gives us then an opportunity to look at an entire package and with a bit of discovery, figure out what other needs are available as well. Because as we touch upon some of the things in the planning process, we're looking at this beyond just a single product initiative. We want to make certain that we're covering things across the board. And some folks are going to handle that through a bundling of benefits through the Medicare Part C programs. You will have noticed, if you are active in this area, that the AEP and NAHU certifications are now available for 2023. And we're not even done with June of 2022. We need to make certain that we take care of the preparation process, but also accommodate the choices and do so in a fashion that creates business for us through the remainder of the year. Let's look at it. 7/1, 8/1, 9/1, 10/1, 11/1, 12/1. We have 6 effective dates yet available on a monthly basis at this particular point in time, and we need to look at what we need to do to factor that into our planning process going forward. We don't want to look so far down the road that we don't see the different traffic signs right in front of us as well. Choices that folks are making, they're a little bit different than what they've done in the past. We see a little bit of a surge in the Medicare Advantage enrollments, but it's still a fairly even split between the two base medical coverages. And we need programs within our portfolio to accommodate that. If we're not looking to take advantage of a full portfolio, it behooves us to have a partner that helps with some of the things that we don't cover. And how do they reciprocate that back to us as well? Original Medicare, keep in mind, that can be people who, well, they may have retirement programs through work or a union, or it might be the Medi-Medis that you run into, the Medicare, Medicaid beneficiaries. It might be folks seeking care through the VA system, or it might be people that just said, hey, I'm sticking with what I got and that's it. In each of these categories, planning for the opportunity when we visit with each of these individuals can make a big difference. And in doing so, we need to be able to translate the information that they are receiving, and in most cases, not reading or studying to any degree. So CMS does have an acronym guide made available to us. And look at that. Gee, at this particular screenshot, 4,420 acronyms defined in this guide. Doesn't hurt to have that available to you so you can properly communicate the information that you are delivering and help interpret the information they may have received from other sources. It also reminds us that in the course of our conversations, we need to limit the amount of acronyms that we use, or if we do, that we define them as well. CMS, Centers for Medicare and Medicaid Services. There's an acronym right off the bat. Some folks know who that is, some don't. I mean, that's a basic. So having this information can be very helpful in communicating properly. Because of where we are in the calendar year, we need to look at the different election periods and plan appropriately for them, as we have most assuredly earlier in the year. Post last AEP, we do planning processes for the first part of the year. So we're looking to go into that annual election period with our duckies in a row, so to speak, and make certain that we, in the meantime, accommodate folks who qualify for special election periods. Look at that. There's a number of them out there. I would say the majority of people that are on Medicare qualify for a special election period or a special election period. The question is it in their best interest to change their coverage at this particular point in time? In most cases, it may well be, even though we're in June and July and we're starting to point for 2023 already, we find that in the course of regular evaluations of plans, it's not being done by the majority of people. 7 in 10 Medicare beneficiaries didn't compare their plans in a recent enrollment period, and those numbers haven't gotten any better. What this does give us, however, is an opportunity to speak to people based on their circumstances that may have been adversely affected by not looking at their coverages. We all know that the plans change year to year. We're looking for that early reveal of some of those Medicare Advantage and prescription drug plan informations so we can start planning for that eventuality. We're cognizant of that fact. Many of the people that have made their selections that may be in particularly vulnerable groups that haven't looked at their programs, well, these are the people that really need our help, because these changes in a plan from year over year can make a huge difference into the wallet that covers, or the purse that covers, the cost of these benefits. And having the tools to do a comparison is paramount to our success here as well. And that's part of the planning process, making certain that we're prepared to deliver upon that information and do so in a manner that is delivered by the choice of the individual. Because they're not looking, I mean, if you look at the different pieces that are out there that are put out there by the government, the website, the toll-free number, the handbooks, they're not being used as well. You've got some really cool new little toys that have come out recently that most of the folks on Medicare aren't using either. And that paper copy or the electronic copy of the Medicare and You handbook that's sent to everybody on Medicare in October isn't being read either. And for those of you that have popped that book, well, there might be a good reason for that. It's pretty lengthy. Reading of it isn't too terribly bad, but some folks just aren't doing it. That gives us the opportunity as an independent insurance agent to go through and address questions put about by the different programs in which they are already enrolled, and also make certain that we're able to deliver upon an explanation of some of the changes that come about now. So when we look at how we deliver that information, things have changed over the last 2 or 3 years. Many of you may be working in a virtual environment for your work objectives at present now, and that is fairly common. And if you're not doing it, just just the uh, exclusively. I don't know why it took me a while to say that. Well, you might be selling yourself a little bit short, because there's a whole bunch of folks out there that really want the information, they want the explanation, but they may not want it in the old style across the kitchen table, shaking hands, kissing babies. Some might. Some might be wanting to do it virtually and deliver upon that. This, as part of our planning process, brings to mind, are we looking at this recently trained segment of our society and delivering the information in the manner that they're requesting? It saves us time in many circumstances. These folks, for over a year, most of us, when we went to go to the doctor, it was handled on a virtual visit. Um, Hospital prep done much the same way. Some of the things that are done with dental, even, and of course, day-to-day parts of our lives. Many of the celebrations of our faith have been done virtually too. So we have a population that is more open to, or even preferably wants, information delivered virtually. Having the tools, either through carriers with whom we contract or the organizations with whom we market, such as ourselves, are they delivering upon the vehicle that's necessary to deliver that information? So, going into some things specifically, as we prep and plan for 2023, let's look at the fact that if you don't have a goal in mind, it doesn't matter what you're doing. As we sit down and we think about our plans and we realize that to move from point A to point B, we got to know what point A and point B is, because otherwise it doesn't make a difference. We all have our needs as to what we want to do to satisfy ourselves intrinsically and extrinsically. Are we making the money that we need to? Are we delivering upon the business that we promise different organizations or individuals? And are we basically accommodating our target population? That's the most important thing to deliver upon. And that gives us then a path to follow if we know where we're going with it. So that goal, and a written goal, is a big determining factor when it comes to setting up your plans. Gives us that destination, and it gives us the opportunity to go into a planning process based on things that are specific to our situation. You're doing a lot of things for a lot of different people, but a lot of that goes back to you and your family and the people that are most important to you. So, are we looking at what you're looking to achieve as part of your day to day operations, taking that step towards your destination? And is it going to take you where you need to be down the road? Many of the programs that we look at in the Medicare world have strong renewal programs where the payments are coming to you. Most of the MA plans now are lifetime renewals. You're seeing that go into some of the Medicare supplement arena as well, and with some of the ancillary programs that are part of what's necessary to accommodate needs for our prospects and clients. That gives us that residual passive income that is basically our salary moving forward. So, doing a program or creating a program that tells us what we're going to make now, obviously, will greatly affect our income down the road. We also want to make certain that the goals are smart, that they are set with a bit of a stretch, but are attainable and are reasonable. And a lot of that then is based upon the lucre, monies. What do you need as a day-to-day operation to make your basic bills? What do you expect to make based on your planning, and how that can affect some of the processes that you have in play to get someplace? And then, of course, there's the stretch goal, in a manner of speaking, as to what you would like to make. Let's face it, we're not in this business to be just social workers. We need to provide for ourselves and our family, and those that depend upon us. And this is a key factor as to how we plan. So that plan, yeah, there's a put this one in here. I debated back and forth as to the graphic. Everyone wants to be a beast until it's time to do what real beasts do. That means in many cases we're sacrificing different things when it comes to time, or As Mike Tyson used to say, everybody has a plan until they get hit in the mouth. Well, then do we need to make certain that it's part of the plan growth, or is it time to adapt that program as well? Because it's going to be a change for a lot of it. The old definition of insanity, expecting different results from doing the same thing. If we stretch and go to or add additional possibilities or tweak it, it's going to make a difference. So our goal is to get in front of the buyers. How are we going to go about doing it? Well, part of it is analyzing your own situation. Are you going to be a virtual agent? Are you going to be a hybrid agent where you're doing some things face to face, also online, or are you straight online? We've got a number of folks that are doing it in that fashion. And if you make that choice, how does it affect the products that you want to market? There are some things that you can do compliantly with one program that you can't for another. And that's one of the reasons we look in many cases for a diversification of the portfolio and our marketing approach. It doesn't have to change everything. It's adding a new component in certain circumstances and utilizing new partners to help that. Shake it up a little bit to make certain that it works. Because, hey, what are we now? In our third year of this great pandemic? We don't know what the fall is going to be. We need to be able to have contingency plans in place and be ready to not only follow the regulations and do so utilizing that as a way of guiding our plans, but we're being proactive. We're not sitting and waiting for the phone to ring. That's brilliant, John. Well, if you think about it, you don't get kissed if you don't ask, or if you don't go on a date or whatever. It's just like you're going to kiss yourself. Well, that's James Brown. Ugh, step back, go kiss myself. Ugh. Well, that's a politically incorrect cartoon right now, but I still like Pepe Le Pew. It's one of those things. While being proactive, we need to do it. One of the folks that we're proud to associate with here at Premier Marketing through our Integrity Marketing platform is chairman of the board in this area, and that's Steve Young. And a lot of times when we look at a plan, we bring in sports analogies and how it's important to prepare. And one of the challenges we have with agents that this kind of illustrates is the fact we can't abandon the basics, the blocking and tackling, the things that need to be done on a regular basis in order to make certain that whatever lovely plan we put on paper actually works. And that's what Mr. Young speaks of here, where we're doing preparation and making certain that we're able to deliver upon our objectives, because we're aware of the fact that there are some things we just need to do. So a lot of it, you base it on money as a bit of a mathematical formula. I'm utilizing very conservative numbers when it comes to commissions and how they work for you, not taking into account some of the folks that may drop off, or the folks that, oh, gee, that didn't came from heaven. So let's look at some different things, come up with just whatever number you feel is appropriate in your market, because the dollars are going up. How that works on a basis, particularly in the Medicare Advantage world, of is it first year commission or renewal dollars? Because that makes a huge difference. Twice as much on a new person versus a person that's already been in the system. We have a goal of 6 figures of some sort, and we divide that by a base commission number. It gives us that number of sales that we need to make that objective. And furthering the mathematical formula, we work backwards as to how many leads that takes in order to reach that sales number, which in turn enables us to come up with the income that we need. So where are these leads going to come from? I left this one in here intentionally with a 2% mailer return. So if you're utilizing 2,000 mailers on a regular basis, you're getting those 40 leads. And how are you closing them? We know that there are stressors on direct mail, and the lead percentage may not be as strong as it has been in the past. It's not dead by any stretch of the imagination, but that gives us then an idea of, as we plan that mailer, what companies are we going to work with to deliver that mail, and what letters are going out, which will affect some of the products that we're featuring. Are we doing the reviews? Are we doing a different product that's a demand product to get people in our book of business so we can deal with them? Obviously, a hot way of reaching out to people is through social media as well. We've got different recordings that help you talk about the different types of social media and how about to go about that. I didn't include all of that into today's presentation because it's going to be long enough. I need to speed up. But however you come about these leads, are they going to be the type that will actually sell? Are they going to be the folks that are looking for programs that we offer or can offer? And then are they eligible for them? Can we make it work throughout this process? Keep in mind, look back on a few slides earlier where a whole bunch of people aren't doing the evaluations. It's having that hot button, that hook that makes a difference, that reminds people, hey, we need to look at your current situation, because as of the first of the year, that current situation is not going to be the same. That's the only thing I can guarantee you. The only constant is change. So looking at that and incorporating in what we do as marketers, as insurance agents, as financial professionals, where are these folks going to come from? There are, through that course of discovery, a filling of the funnel, because we're going to run into people that may not be eligible for our programs now, that may be down the road. But a lot of this will come about through the whole subject matter expert in a particular area, where you are building your reputation with people, influencers in that area, to help you be labeled the person to speak to about your business. There are still, of course, the lovely relationship with Ma Bell. I can pretty much guarantee that anybody that's on the line right now has probably received a number of robocalls or whatever else already through the day, or your spam filters within that, or whatever the call blockers have peeled that out for you. However, for certain initiatives, that can still be a very viable way of reaching the population. We talked about the mail campaigns that are part and parcel of a regular program. And of course, one of the things that I think that we do well and we don't do enough may well be the fact of asking, who else can I help? A recent article I read said only 11% of the agents are asking for referrals. That goes back to Pepe Le Pew. Are you asking for it? And then, of course, those influencers within the community, well, that gives us not just an opportunity of setting up events for open enrollment, but it gives us the opportunity to speak to delivery of information now. Because part of the plan is we got to get to AEP as well. And how do we do so? Well, setting up different events with a agenda of different programs, a listing of different things that we can speak to, can make a huge difference. And we have some excellent programs out there that speak to these, are presentations that you can use with the community, either live or through a webinar type of setting. This is where we go into the whole mix of what do we have in our portfolio and what are we selling. For folks that are involved specifically in the Medicare arena as their main focal point of procuring business, well, the percentages may be a little heavier in one area than in another. But some of what we can deliver upon to make our goals is simply being aware of the other needs of the people that we visit with and handling it in the fashion that's dictated by the plan we've worked out. There are folks that will work the appointments as much as possible, close together as possible, for that key component. Are we looking at a comparison of Medicare Advantage plans? Are we expanding that onto the different Medicare health choices that they have, and speaking of med sups as well, or vice versa? And in doing so, it may well reveal those needs for the additional coverages, the life insurance, the final expense, the long and short-term care programs, the ancillary benefits, the dental, vision, hearing. Particularly if you're looking at health business, yeah, dental, vision, and hearing is going to come up because Medicare Advantage plans may have some coverage for that, may not be enough. Medicare supplements may have some discount programs, it may not be enough. But if we look at this and we look at our current book of business and where the products fall that we've sold, that gives us an indication of where some of these dollars can be coming from and clue us into, do we want to alter that strategy? Do we want to utilize something else as the opening hook, or concentrate in one area and then circle back with regularity to cross sell? Cross sell is going to be a huge thing with all these programs regardless, simply because the needs are there, but the regulations may prohibit us from doing things in a one call close. We may be able to visit about Medicare programs and other health programs. They want to talk about long-term care, short-term care programs. Well, you got that 48-hour cooling off period. So it changes how we schedule things. They may want to speak to anything else that's not a health program. We got to go back to do it. Life insurance, final expense. And some of those can be a big contributor to our bottom line. And following the rules not only keeps us compliant, keeps us out of hot water, it also gives us the opportunity to cement that relationship, because it's another opportunity to ask for referrals. It's another opportunity to fill our calendar. It's an amazing chance for us to do different things to make our goals come to light. So break it down into the simplest of day-to-day activities through weekly activities. What do you need to do each and every week in order to make that goal? A little bit of mathematics, nothing brain twisting here. It's all a question of, have we set the goal? Are we looking at just number of policies and let the commissions fall as they may? Are we looking at particular products because they have a different commission structure than the others? How's this going to affect what we do day to day, week to week, month to month, now and moving forward? We also need to take into account our skill set. New products, we may not be as good of a closer in them. We may not know that product as well as some of the others. And in the initial periods that we have with a lot of the Medicare Advantage plan information that's rolling out, or new Medicare supplements and how they're underwritten, whatever it happens to be, that training process can make a big difference. And part of that is we get better riding a bicycle as we ride it more, whatever it happens to be in that area. That will change our close ratio from the beginning of a period through the end of it. You got other factors that come into play, but that will affect the number of appointments we need and the number of leads we need to get those appointments. So that is something to consider as we go through our plan now and through the end of the year, because, well, it changes what we need, plain and simple. We also need to be able to track our results. So for many folks that are still brick and mortar, pen and paper, you can track it that way, obviously. There are a ton of really cool online automation programs that can help, and then systems, different CRMs that can come into play to help us there too. That is all part of a key planning process. Because if, hey, we're busy, gee, how can I be so busy and how can I not be selling as much as I'd like to? Well, it might be as simple as the fact that what you're doing isn't making you money. You're busy, but it's not productive. So having a way of tracking that can make a big difference. And it gives us the opportunity to go back and say, hey, I had a number of appointments offering this product. I'm not selling stuff. Do you need to reevaluate the product? Do you need to reevaluate your skill set in delivering upon that? Are there other components that you can bring in that can make you more successful in that area? We're looking at the base programs. All the big carriers, insurance carriers, have agent managers in the field or virtually that can help you with different marketing techniques and skill set there too. It's important for us not just to certify, but to utilize it to learn those programs so we can be more successful in that sales process. And looking back and being able to track those numbers can make a huge difference simply because it's telling us that, hey, this is working, this is not, or whatever. How can I get better at what I'm doing as well? Plotting it down, the old daily planners. Boy, I still have a number of them. I have this problem throwing some things out sometimes, evidently. But you can look back and you can see, okay, when am I planning to plan? When am I planning to fill my week? How am I putting in place contingency programs if someone cancels on me, or this didn't happen as I thought it would? These local area marketing pieces, events that I'm doing, well, they didn't deliver upon the people I need to talk to. So what's our contingency plans to come up with to address that shortfall? There are different ideas on accountability for some people. Many like to internalize it and make it a part of their daily drive. But for those that have family or business partners or other people that they are obligated to in a way, how are we holding ourselves accountable to that plan? It goes back to our desire to make the numbers work that we've put on paper, that we've got in our head, however we're doing it. Obviously, recommend putting it down paper. Makes you more successful statistically, it's shown. But it gives us then that opportunity of, is our family bought in? If you're working in AEP 12 hours a day, you're going to miss some family events. You're going to miss family time. That can be a big difference. How is your family bought into what you're doing as well? And that may entail a discussion with the people in your household. That does, however, also give you the opportunity for them to help you out a little bit. Are they going to do some of the paperwork or whatever else is there in the planning process or marketing for you, in doing that to help? For many folks that are progressed into an office situation where they may have downlines or everything else, you're accountable not only to yourself, but to the obligations that you've set for yourself and your organization, to the different companies that you work with, and then, of course, with the folks that you work with in production. So accountability is a big thing. You put it in play. If it doesn't matter, well, gee, then it's a wasted effort anyway. Some of those efforts that can help put you in play, well, you got to put these down too. One of the things that I have heard a number of times when I speak to my different physicians and everything else are you planning for the things that you need to do to make you successful? You want to lose weight? Have you scheduled time to exercise? Have you scheduled time for food prep? Have you scheduled time for whatever else it takes to do that? The same thing carries over to the activities we have here. Have you scheduled prospecting time? Do you have the tools that are necessary to work things out when things didn't go as planned? And gee, are you factoring in some of the different things that affect our most valuable of commodities, and that's our time? So are we limiting some of our windshield time? Are we doing things where we're scheduling things where it limits the amount of travel between appointments? The different things that come into play there with the tools that are necessary to do some things electronically. It gives us then a different perspective as to how we can use the hours in our day. And that is very, very important, because if we have a major event in the community that we're part of, is it going to generate some immediate leads? Are you doing a true presentation of sort, or are you working a community event to garner just the leads themselves? Big thing that comes into play right now is for many folks that they're involved in retail. Oh, gee, Walmart. Oh, gee, working with United or Anthem or Humana or whomever, uh, Aetna with the CVS programs. Are we doing that, and are we making it successful? Or are we just telling ourselves that, hey, we're working, we're busy, this is going to work out for us? Well, sometimes it does, sometimes it doesn't. What are we doing in the event that we need to alter that as well? So preparing ourselves is a big, big, big component of this. You can have all the plans in play, and if you don't have the tools in your head, in a manner of speaking, to make them pay off, it makes a big difference. You're getting hit up, or soon to get hit up, with carrier trainings and certifications now. I mentioned the AEP being out for almost a week, NAHU being available for a day or so. And some folks will look at those trainings as some sort of penance, time in purgatory in order to get to heaven, in a manner of speaking. It can be that way if you want to make it that way. But if we look at those trainings and internalize them to the point where, gee, this is going to help me be better at my job, that can make a big difference, because some of those certifications may be necessary to do some of the marketing that is supported by the different carriers. And it gives us then the opportunity to make certain that we stay current. It also prompts us to look at the market that we're choosing to focus on, if we are, what is available moving forward. So that means we have to be able to get that information, internalize it, and then when we're able to compliantly disseminate it, how are we doing that? It also then gives us the opportunity to get that information in play, put it in our plan, and reach out to not only our contracting organization, but that carrier as well, to see if or what they have available as additional marketing programs as well. We've got a lot of carriers that are going to be pretty inventive this year when it comes to supporting marketing activity. And having that relationship with that carrier then, and the personnel that help move the marbles, so to speak, in that, can make a big difference. So we need to have that in play, because it helps us develop that relationship and can help the leads that come in that fashion. Some of the things that we do now also are the indicator of creating business immediately. And plain and simple, we're not doing everything in June and July to look at October and November and a little part of December. We're looking to see how we can affect business now and how that sets us up for the fall as well. So knowing some things that can get us in front of individuals that helps us schedule in the future can be a big difference. What am I talking about? Well, do you know the entitlement programs? Are you comfortable with those assistance programs, the low income subsidy, extra help programs, the Medicare savings programs? Because if you're going into the community right now, that's a hot button. We're in June. Some of these folks may be in the quasi donut hole. Well, donut hole doesn't exist supposedly, but the programs out there still have more monies coming out of our prospects and clients' pockets at this point in time. Having that information available helps people now, creates that special election period, and sets us up for the fall, sets us up for the future, because the people that are scheduling those type of events then realize that you have the skill set to take care of the people that you're visiting with, their people. Everybody, Emancipation Proclamation was what, almost 160 years ago plus. Nobody owns anybody, but everybody is their people. The people you visit with are your people. And creating that wealth bank of, hey, I'm going to take care of these people, our shared people, that helps you schedule things now and down the road. It's incredibly important then to make certain that the tools that can make those comparisons and that selling process simpler, quicker, cleaner, more compliant. Are we trained ourselves in how that program operates? If you're working with Premier Marketing or Integrity Partners, our Medicare Center's got 3 quoting engines right within it. Are we comfortable on how to access that and how to use those different systems? And to that point, which one do I use and when? Are we utilizing the CSG tools that are within that give us heat maps as to where business may best be procured? We have that technology, as they say on the old $6 Million Man show. Utilize that as part of your planning process. It then also, because of some of the other things that come in with Medicare Center, gives us an opportunity to use that client database within that, the different tools that can score and store our scopes of appointments, and going back and visiting the people whose data are in there from last year. That annual review, that gives us a chance to make certain that we're doing the best thing for our clients and our prospects, because, hey, we might have people in there we didn't sell. That gives us the opportunity to have a base number of people to visit with. And for some of us may be thinking right now, well, gee, John, if they're already my client, they're going to, 70% of them aren't looking to change anyway. I'm going to keep a good portion of them. Why am I doing this? Well, you're doing the right thing, but it's also the opportunity for the best type of marketing system, and that's getting referrals because of the way that you handle your current book or the people that didn't buy from you. Being aware of what the Medicare.gov plan finder is doing this year. There's been some changes on that the last few years that haven't been totally pleasant. It's changed how many of us have used it, but it is a piece that's out there that some people do use. Are we familiar with how it operates and how we can utilize that information to our benefit? Gee, John, you had a slide there that says a whole bunch of people aren't using that guide. Well, they're not. One reason or another, some of them are. We want to be prepared for that contingency, and then we want to deliver upon that information in a different fashion. And of course, the referral process of taking one lead and growing it beyond that as well. So those basic certifications, I've mentioned already that AEP and NAHU are out. The different carriers are kicking out their certifications as well. What best fits you? Are you showing a number of programs? The AEP system, well, some carriers will even help pay for it. We help pay for it in certain circumstances. So are we doing that to have a full portfolio, or, hey, I am an agent for this carrier. They don't require AHIP. I'm not going to do it. I'm going to do their certifications. That's fine if that's part of your plan, but keep in mind, you're going to run across folks as an independent broker that say, no, ain't doing them. Do you have that contingency plan then with another carrier, other programs that you can show? These basic certification processes enable you to do that as painlessly as possible. So those certifications are starting to roll out. Our website's being updated now with information about the certifications, because the info that's on there is still for the remainder of the year. For folks that haven't been active in this space, well, doing the 2023 certifications, in most times, in most circumstances, that enables you to sell the 2022 through the rest of the year as well. If that doesn't give you a little bit of a wink, wink, nudge, nudge as to, hey, we want business now too, well, reevaluate that, because that's all part of a program moving forward. There are also additional trainings that the government puts out in addition to what the carrier does. So the Medicare Learning Network is a great tool for you to grow your knowledge in certain areas, and they have presentations available through this system that you can use with the public. You don't have to reinvent the wheel when you go through and you speak to a Medicare 101 presentation. They've got like 3 different versions in there for one way or another. They've got some things that help us with, well, a presentation we're doing coming up with Medicare in the Marketplace. The information I use in that presentation, it's taken from the Medicare Learning Network. You have here different possibilities to help grow your skill set, but also give you tools that you can use to market either live or virtually. Once again, they give you that information on how to properly communicate through an acronym guide. And this is a really cool site that many are aware of, some are not, but it is actually different pieces that you can use through a government site that enables you to come up with different support material for your sales processes. There's actually a piece in there where you can order 50 calendars a month free. The government delivers it, and you can use those as tchotchkes, as giveaways, whatever it happens to be, as a reminder to yourself that we're planning these things and we're plotting them on a calendar. A great way for you to get additional detail to help you in your sales processes. I've got a piece here with this link that actually goes through and walks you how to do that. I got to tell you, it's not rocket science, but it's a way for you to go in there and get the material the government's supplying that many people aren't aware of. It's also, of course, important for us to lean on our carrier partners. This is an example simply because United Healthcare has been doing the Medicare Made Clear program for a long time. These materials are made available without cost to you in most circumstances, a great way for you to market United Healthcare. But some of these basic programs, they may be logoed, but they don't have product specific stuff in there. And I'm not saying United's the only one that does this. Humana's got great support programs. Anthem's got great support programs. Aetna's got great support programs. Many of the strong regionals, they're going to go out there and bang the drum really hard for you because they want the business. And this is one of the ways they realize that they can do it. Look to the carriers for that additional help to make certain that you are procuring that in a timely basis as well, hence tying it back into the planning process. And that then brings us to, do you have what you need in your portfolio to be successful in your chosen market? We need to research those carriers. So as the data comes about for 2023, we can search into that. But we have the capability of doing that right now for the remainder of 2022. And that gives us the idea of, boy, I need to pick up this carrier and I need to establish a relationship with that carrier's local management to support my efforts. Doing so and realizing what you can use and how it fits into your plan, you have to do it, plain and simple. The Medicare Center program that I alluded to and went on a little bit about, and I'm starting to go a little really long here, is of course, a program that's available to our contracted agents without cost. Yeah, you can tell I'm an old MA agent. I have a hard time with the word free, but that single universal login gets you access to those 3 quoting engines powered by Connecture, Sunfire, and CSG. It enables you to send out side-by-side plan comparisons electronically and compliantly. It allows you to collect those scopes of appointments and store them for that 10-year period if you sell them or not. Keep in mind, you have an appointment, they don't go with you, you still need to keep that scope and store it. It's also got that CRM within that you can use to work your book year round, but also give a year-to-year review based on the data that's in there. You're using it to quote the different prescription programs, be they part of a Medicare Advantage plan or a standalone PDP. That gives you the way of reaching out to folks and say, hey, new plans are out. We want to make certain that your current coverage is still the best option for you. Let's do a review. Are these still the same medications? And that tool also has different resources in there that include scripts and other things that can make you be successful, help you be successful as well. That is free to contracted agents, and that is a key component in the planning process because it can really cut down the windshield time, it can make you more efficient, and keep you compliant. It's also a piece in there that we talk about heat maps that different carriers will put out and that sort of thing. The CSG tool within here will give you penetration into different markets. So if you're targeting a particular area, coming up with this information might well give you an idea as to, boy, I need them as part of my portfolio, or gee, this is what I'm going to run across as I visit with people. And so am I aware not only of what I'm doing, but what the competition makes available. And we're not putting all our eggs in one basket. We realize that there are options for folks out there where one size doesn't fit all, and we need to be prepared to pivot. Hopefully, some things change in the world here and we don't have some of the challenges of being locked down or whatever it happens to be. But if that changes and there are meetings that we have in play that are meant to be face-to-face, are we able to deliver that information in a different manner and do so in a way that doesn't really vary from what we're doing face-to-face? When I did a ton of presentations, if I did a group presentation or if I did one with an individual, basically the same presentation in the Medicare Advantage world, because I wanted to make certain that I covered all the points and I covered my large behind. on a compliance basis, but also to make certain that they understood what was going on, can make a huge difference for you. So let's look at some of the different programs here really quickly that we can put into play as part of a comprehensive plan. Remember, you can still cold call for certain things. We see many people do this very successfully if they're tweaking the approach. There are folks that will cold call for med subs, can't for MA and PDP. We all know that. That's a compliance no-no. But there are folks that are using dental programs for folks that are 63 or 64, aging in a manner of speaking, and they're setting up their book so they can go back and discuss other programs down the road. You have the different ways of reaching into the community with those centers of influence. You have programs out there that can help you be successful in each of those niche marketing techniques. Carriers, as I mentioned, knowing what's going to be good in your area or knowing what is strong now, what are those carriers offering to help make us successful? Social media programs, Facebook is huge in this market, but it's also something that we need to be aware of, that it is a microwave, not only lead source, but a microwave response as well. Referrals, we can talk about that in a little bit. The direct mail programs that we have in play can create a consistency for you across the board, and planning on them now and ordering them now is important, because many of these vendors will have blackouts as to different letters that can go out into a different area to protect the people that they're doing business with. So it's getting your dibs in now and planning for it. That T65 locator I'm going to talk about in just a little bit as well. A great tool to use, but also a great piece to help you in contingency planning. Utilizing Ma Bell, well, we've got different lists that are available for you. You can set them up with different parameters as to what it takes for that person to be a successful prospect for what you're offering and how you're going to go about doing it. Keep in mind, big brother on a telephone now, everybody knows who's calling. Spoof calls drive me nuts. But if you're putting your name out there and you're following up perhaps on other correspondence, whatever it can be, that can still be really effective for you. And these can be available to you at, well, you can buy them fairly inexpensively depending upon your relationship with different marketing organizations. We may well be able to supply them to you without cost. And remember, not all programs allow for cold calling. Certain parts of our country, certain states don't as well. Community-based programs, these are big things. We're talking about the third round of Walmart closing down already. We got different carriers out there that have different opportunities. This is a key component for many agents that are marketing, but it should never be the end-all be-all. Utilizing the different programs that you have in addition to this, you can make them all more successful simply by utilizing the strengths of each of them. And with retail, hey, acting as a second office in a manner of speaking, where they can come visit with you and get information, and we can consummate that relationship virtually or through a private conversation for both the base product or any additional programs they may need. Working with providers right now, it's a key time to reach out in the community and visit with those that are delivering the care for the programs we're offering. So this goes beyond just doctors, but those primary care physicians, many times they are bombarded with sample requests or, gee, can you help me with what program might be available, even though they're not insurance professionals. Making certain that these influencers within our community realize that we can deliver upon the things we need to do to make their life easier now will give us business now, and gives us the opportunity to look at that patient base on an ongoing basis and feature it when it comes to the time that we need to do the open enrollment, where people are more aware of, gee, do I need to look at other things? Great way to do business now and in the future. And it goes beyond those doctors, if they're contracted or not. There are docs out there that need our help that are not part of a network with a different mindset. Dentists have the same thing. Other organizations that bill Medicare or are part of a network can be a great partner in this initiative, both to maintain business and to grow it moving forward. You have the other centers of influence in the community, such as the faith-based organizations, where people will respond to communication through their church, through their synagogue, through their mosque, that they don't through the multitude of commercials we see on television, the mail that goes out, whatever it happens to be. We have a program set in place that helps you understand how to work with faith-based organizations. Goes beyond this one is actually the website that helps us with some of the Christian locations. We have those available for synagogues, mosques, whatever it happens to be. That's a separate training that we do and can be very helpful for you. I mentioned the fact that working with carriers, if you've done business with them in the past, it's the old quid pro quo. They're scratching your back, you're scratching theirs. They may have leads that come about as well. They got a captive force. Sometimes that's a Lazarus lead where you're looking to resurrect it, but it may well be a good lead because you contract with the organization that that carrier couldn't compete with. And we're obviously going to render unto Caesar what is Caesar's, but we're going to do what's best for our prospects and our clients. The internet leads are based through Facebook. We have programs set up for Final Expense and for Medicare. It's a great way to fill in the holes. This is a great way for the folks that are being electronic minded of delivering upon what we need to deliver. And of course, not only asking for referrals at particular points in time in the sales presentation, setting up the appointments, but also circling back to our existing members to mine for that information. Direct mail, it's a consistency thing, plain and simple. If you're doing things on a regular basis, it's like an exercise program. You're going to go beyond the pain. You're going to see the good effects that come to it. But you need to put that in play now because, as I mentioned, many folks were going to look at direct mail now. Direct mail goes up in volume, obviously, during open enrollment period. We want to make certain that you get yours. That gives us, however, an opportunity to use different letters to maybe come across with a product that's not our main thrust, dental, and cross-sell off of that. So it's not just working the base program and adding to it. It's utilizing some of those demand products and working backwards to grow our book as well. A T65 locator that I bounced on, and I apologize, I'm already over an hour, but this is a program that's free to our contracted agents. You download it to your smartphone, you register for it, they find that you have a product with one of us, and it gives you the opportunity to put in different parameters and find out where they physically are. So if you have an appointment that's scheduled and it cancels on you, you can do a number of different things. You can door knock for certain products. Can't for MA or PDP, but you can for dental. Hey, I'm out here, it's a different type of approach. And it is something that can make those canceled appointments valuable to you because it allows you time in a particular area to work with other individuals as well. So some of the things we're going to help you with here are, let me pop here because the questions have popped up. And one of the things that it's being mentioned is because of some of the changes that are brought about by recent CMS rulings with the recording of calls, that is coming to Medicare Center. So that capability is coming. And we're going to have specific trainings on that. So thank you for that question, for one thing, but also it gives us that opportunity to leverage technology and make it work. We make things easy for you to contract as well. We keep talking about cross-selling or using a different lead product. The entire process of our world is going electronic. And part of it is, you can't submit an incomplete form. You don't have to worry about your handwriting. It can be quicker in the delivery of the information request and the response. Setting up a profile within SureLC, Assurance Bay can make a big difference on how to speed that up. There are, of course, different carriers where we're going to want to make certain that we're using their electronic process to contract directly and make certain that it works. And you're welcome, Lauren. Thank you for that question, actually. We do offer discounted errors and omissions for qualified agents. What makes you a qualified agent? Well, you contract with us. This is a program you own, though. No marketing organization has every product in the world, no matter what some may tell you. This gives you the opportunity to satisfy the requirement from the insurance agents to have your own, finger quotes, working malpractice insurance. You own it. It's reasonably priced, and it takes care of you across the board. We do also offer discounted continuing education programs through our association with WebCE to keep your license in play. You have an opportunity to grow your own benefit package through a modified guarantee issue disability income program for yourself that you're paid a commission upon. And much as where today's presentation is being recorded and will be made available on our website and on our YouTube channel, past presentations have as well. I kept alluding to the fact that, okay, you're going to work with churches, here's a track to follow. You're going to work with providers, here's a track to follow. Those recordings are available online 24/7, as this one will be as well. I cannot overvalue the use of Medicare Center because this is going to satisfy that request, as Ms. Moore mentioned, of how are we going to record things? How are we going to deliver upon information compliantly? How are we going to store those scopes and score them, make certain that we're asking for them and getting them back in a fashion that the individual can handle? It's a great way for us to maximize our time, be as efficient and compliant as possible. And many of the programs that we may have available to ourselves as an adjunct program may come with additional dollars available. Are we aware of the other incentives that we have to make, well, gee, med sups, if I do this many a month, they're going to pay me this much above my commission. If I sell this many ancillary programs, dental, vision, hearing, cancer ancillary programs, bonus programs may be coming in play. Can't call them bonus programs, forgive me. Additional incentives that may help you qualify for carrier trips and additional incentive programs within our organization as well. There's a page on the website that lays that out for you. Once again, look at those lead programs. How can they work? Our direct mail program is a discount program based on production, but it gives you the opportunity then to operate consistently and through vendors that have been vetted and have the technology to help deliver those leads to you in as quickly and as timely a fashion as possible. We also have an organization we work with that will deliver upon untouched direct mail response. The cost will vary from time of year to time of year and area, but it's a great way to fill your calendar with people that have raised their hand saying, I'm interested, and haven't been talked to yet either. So it's all an opportunity for us to work with you to help you develop your plan, going clear back to the basics. Do you have what you need to sell? Are you prepared through the training process to deliver upon those products in a fashion that people will buy from you? And how are we going to make certain that back office support is there for you? So as you look at some of our Y Premier presentations, you'll find key individuals that can help you across the board in that fashion. So one of the things that I really want to stress is the fact that, okay, AEP planning, that's now. It's an involvement of different activity that can affect our production now as well and set us up for AEP. It'll fill our calendar now. To get on the schedule of some of these organizations, you got to do it now. You need to make it part of your marketing program, internalize it, don't procrastinate, and move forward with it. What it'll do for you beyond setting up the fall is increase your activity now as well, increase your production now as well, increase your dollars as well too. So all that said and done, I want to check really quickly to make certain that I might have made all of the or covered the questions that have popped up. And I believe so. So at this particular point in time, for those of you that have done business with us here at Premier in the past, I thank you for that business. I look forward to the opportunity for us to continue to grow together and broaden that appeal for the different programs that are out there as well. For those of you that are considering working with us, Thank you for that opportunity. Much appreciated. But I've spent an hour and 12 minutes now, actually an hour and 10 precisely, of your valuable time. I thank you for the investment of that time. I urge you to take some of these basics that we delivered in today's presentation and make them part of your planning process and put it in play. And as John Wayne says in the movie The Cowboys, 50th anniversary this year, slap a piece of bacon on that biscuit, saddle up, let's ride because we're burning daylight. Thank you for the time. And until we're able to visit with you again in the very near future, I wish you good selling. Thanks so very much. We'll talk to you soon.